Hello, thank you for joining us. This week it's Mental Health Awareness Week and the theme is loneliness. So we caught up with Jo, one of our nurses who works in the older person's mental health community teams, to discuss loneliness and the impact it has on our physical and mental health. Hi Jo.
Yeah, I'm Joanna Mcgee. I'm a nurse and service manager for the older person's mental health teams in Mid and North Division for Southern Health.
Yep, thank you for joining us today, Jo. We're just going to be talking a little bit during Mental Health Awareness Week about loneliness. So, Jo, what is loneliness?
Loneliness is a personal feeling. The impacts on well-being, on people's general well-being and their quality of life. It crosses the lifespan, and any member of our community can feel lonely. And loneliness, it can begin with losing any significant relationships. And the inability to engage in meaningful activity.
And what impact can that have on people's mental health then?
So we know that loneliness is linked to a decline in people's mental health, so it can lead to depression, anxiety, sleep problems, increased stress, a cognitive decline and physical health decline. So people's physical health deteriorates alongside their mental health.
How can you tell if someone's lonely?
So you might be able to tell with there might be a change to their routine, a change to their appearance and their get up and go. They might start to withdraw from contact with others. They might just not be themselves. They might start to be feeling more physically unwell with minor illnesses. They might be more anxious, visibly anxious, more worried. And so all these things can lead to depression or a mental health problem, but could also be linked to loneliness.
What could you do if you yourself are feeling lonely?
I would recommend that you reach out to either members of your community, members of your friendship group or your social group. If you're noticing that people, friends or patients or carers are lonely, ask them how they're feeling. Ask them if they're feeling lonely. Be there for them. Take time to listen. There's lots of agencies that offer befriending calls and support lines, Age UK, Silver Line, Samaritans, Shout, all there to listen and provide support if you need it.
And so why is this important, Jo?
It's important to recognise loneliness because of the impact that it has on people's quality of life. Everybody deserves a life that's meaningful and fulfilled. And if we're not able to recognise that and that in the impact that has, then we as a society aren't doing or fulfilling our job to help people and support people through this time. Loneliness is that personal feeling of isolation and loss of fulfillment. So we need to, I think, as a society, to reduce loneliness and social isolation, we need to be more aware of what's in our communities and what groups are out there and how we can access them. We need to make concerted effort to, if one of our patients wants to access that group, how can we help them to access that? Whether through aids and equipment or transport or something that will be able to make them engage in that activity that they want. So, because loneliness is that personal feeling, intervention should also be personal.
Thank you for listening to our podcast. If you'd like to find out more information about mental health services at Southern Health, please visit the website at www.southernhealth.nhs.uk.